My name is Joyce. I use the pronoun she, her, and I am the midwife who's working today.
So nice to meet you.
How would you like me to call you?
My name's Victoria,
Okay.
and I also use she, her pronouns.
Oh, perfect. Well, thank you for coming in and choosing midwifery care.
That's good. I'm so excited.
Yeah, we're really excited that you're here. You probably already met our perinatal nurse, Christine. Yeah. She will have already come in and talk to you a little bit about how our practice works and the model of midwifery care, as well as your choice of birthplace. She might have given you some information on that.
She did.
Perfect. Awesome. She also did me a favor and filled out some of your demographic information, which is really nice. So I see you live here in Calgary.
I do.
Have you lived here your whole life?
I have, yeah.
Very
I
nice.
was born and raised.
Oh, lovely. Wonderful. And I see that she's also filled in some information about your partner. Would you prefer that I call that person your partner, or how do you refer to him?
We're legally married, so you can call him my husband if you'd like.
Okay.
Yeah.
Excellent.
He goes by Tom.
He goes by Tom? Okay. I'll just make a note about that. Do you think Tom might be coming into any of the appointments?
He will, but he's a pilot, so he's away a lot, but he really does like to come when he's home. So he will come, yeah.
Excellent. All right. So Christine has put out your first trimester ultrasound for me here, and I can see that you have a due date of about September 10th.
Yeah.
Does that jive
right.
with what you had for your dates as well?
Yep, it's right around my birthday too, so.
Oh, wonderful.
We'll have a birthday baby this time.
Oh, that would be so neat. Well, that's really great. So I think at this point, what I'd like to do is just ask you some more information from your medical history.
Sure.
While you're giving me the information, I'm going to be writing it down.
Sure.
I want you to know that I am listening, and this appointment has a lot of questions. But if you have questions, you can just sort of tuck them away or ask them when you think that you'd like when I'm doing the history. Sure. Our future appointments, you'll have lots of opportunity to ask questions as well. So the first thing I'd like to know is this your first pregnancy?
Oh. Baby number 3 for me.
Baby number 3, have you been pregnant a total of 3 times?
Yeah, including this one.
Including this one. So you haven't had any losses? No. Okay. All right. So when was your first baby born?
First baby, 2013.
Okay.
April Fool's Day. Trying to remember.
Oh my goodness.
Hard questions when you have 3 kids. So babe was born in a hospital.
Oh, perfect. Here in Calgary then, because you said you've been here your whole life. Yeah. Do you remember approximately how many weeks pregnant you were when you had your first?
Yeah, just over my due date. I think about 40 and 5. Okay. Does that sound right? Mm-hmm. Yeah.
And what was that labor like?
Well, I was induced, and I had, I think it was about, not long, so 5 hours of active labor, and they had to break my water. So I induced with, I think they started with breaking my water, if I remember right. Is this right? And then do the needle in my arm with the...
Right. That sounds right. And the needle is typically, was it a medication to help your contractions? So that would have been an oxytocin?
Yeah, okay. That's what they did. That sounds right. And then I had an epidural.
Oh, okay.
Because it was really fast and furious. And I think I did have some stitches. They said that it wasn't like too serious, but that I needed stitches because there was muscle involved.
Oh, okay. That sounds like a 2nd-degree tear. Did that heal up okay?
Yeah.
Excellent. Do you remember there being any complications during that delivery? Any too much bleeding or any issues with the baby when it was born?
No, everything was really normal after that.
Oh, great. And so your first baby was a boy or a girl?
A girl. She's a girl, sorry.
Yeah, no worries. And do you remember approximately how much she weighed?
7 pounds 11, or like around, they said 3.5 kgs.
Did you how did you feed her?
Oh, I breastfed her for 2 years. It was tough at the beginning, but we managed to make it through, and then it was easy after that.
And has she been healthy?
Yeah, she's a healthy girl.
What's her little name?
Sapphire.
Sapphire. That's a great name.
Like my birthstone.
Oh, lovely. So you said you had another pregnancy as well. What year was that?
I got pregnant in 2014, but 2015 he was born in August.
Okay.
August 20th.
That's a different time of year to be pregnant.
It's awful.
It can be very hot, yes. And did you have a little boy or a girl?
A boy.
A boy?
Yeah.
And what's
His
his
name's
name?
Jackson.
Jackson. Very sweet. Now, for Jackson's delivery, was it also at the hospital?
Yeah.
And approximately how many weeks pregnant were you?
Same as Sapphire. So he was a little bit earlier, like 40 and 2, I think.
Oh, okay.
Just over my due date though.
And what was that labor like?
It was fast. I barely made it to the hospital. It was only a couple of hours of labor.
Oh, wow.
And barely made it and had a baby.
Okay.
So it was really fast and furious.
Fast and furious. So no induction this time and anything like that. Do you recall having to have stitches again?
Yeah, but not as serious as last time. Just a little, like they said, a 1st degree.
Oh, okay. And did that heal okay?
Yeah.
And do you remember there being any complications with that? Too much bleeding or anything with Jackson?
No, I went home really fast after that.
Oh, did you?
Yeah.
Oh, that's so lovely.
It was nice.
And so now then you're pregnant again. It's been a few years since you've been pregnant. Was this pregnancy planned?
Yeah.
Yes? Yeah. Is Tom the same person who, okay.
Same bio dad.
Same bio dad? Okay. All right. Great. And for your pregnancies, for both of Jackson and Sapphire, did you have normal pregnancies? Did you have any issues with your blood pressure or diabetes?
Nope.
Okay.
I did that sugary drink and it was fine.
And it was fine. Well, that's great. Okay, well, it sounds like you do pregnancy really well and delivery, although kind of fast. Sometimes the third can be we don't know what's going to happen, but we'll see how this one goes. Yeah. And depending on what you read, you might be choosing to go back to the hospital again or plan something different.
Yeah, I'm thinking that maybe, I know we have lots of time probably, but maybe home this time.
Right. Yeah. Well, that would be lovely. And as we go through your care, we can talk more about that and whether that would work for you.
Okay.
So I'm going to just talk a little bit about your family history.
Sure.
Does anyone in your family have any medical conditions that you're aware of?
Not that I'm aware of. Like how far back in my family do we go? Like my grandparents and my parents?
Yeah, usually your grandparents and parents, especially your parents, and if you have any siblings,
Okay.
That would be really important. If you don't know, if you can get access to that information, if that's something your family doesn't usually talk about. But if you know some of your grandparents' history too, that can be helpful.
Okay. I'm not aware that anybody has any, like what kind of?
So things like diabetes, heart conditions, sometimes things with mental health like anxiety or depression. And some families will also be aware that maybe their sister, for example, or their mother may have experienced postpartum depression, for example. So that can be included there. Definitely if anyone's had any blood pressure issues, or if people have had babies that may have had issues at birth. So sometimes things like club feet, cleft palate, or spina bifida, things like that.
I don't think anybody's ever had any of those issues.
No.
Like my brother had some anxiety, but I think that's it.
And that's it?
Yeah.
Okay, and do twins or multiples run in your family?
No, thankfully. I'm really hoping this isn't. Oh, we already know though, right? That's right.
Yeah.
The ultrasound.
There's only one. Yeah. And in terms of your hereditary, like from your family, do you identify with a specific hereditary train, or do you know what ethnicity your background is?
Just like British, Scottish, Western European. There's some French Canadians in my family, but I mean, pretty typical kind of Western European. That's all I know.
Okay, great. Thank you. And then for your own personal medical history, do you have any medical conditions that you would like to share with me?
No, I don't think so.
I have a list of things just to help prompt. So do you have any issues with your lungs, like asthma? Do you have any autoimmune issues, like rheumatoid arthritis?
No.
Do you have any bleeding disorders or clotting disorders, especially things that might be like deep vein thrombosis or pulmonary embolism? Do you have any heart issues?
No, never had any heart issues.
Do you have high blood pressure?
No.
And you said you didn't have that in any of your other pregnancies? And diabetes, you said you didn't have it during your pregnancy, and you don't have it outside of pregnancy either. Do you have any issues with your thyroid?
No.
With your stomach? Do you have anything neurologic like epilepsy, seizure disorders? Do you have a history of urinary tract infections?
I've never had one.
Oh, wow, that's so lucky.
I know. A lot of my friends have, but I've never had one.
That's wonderful. What about gynecological? So anything to do with your ovaries, your uterus, your fallopian tubes, any sort of abnormal paps?
Never had an abnormal pap either.
Any issues with your liver, gallbladder? Have you ever been diagnosed with a sexually transmitted infection, chlamydia, gonorrhea, herpes? Have you ever been tested or been told that you have HIV? Have you ever had tuberculosis?
No.
Do you recall having chicken pox when you were growing up?
I did.
Okay. And you mentioned your brother had some issues with anxiety. Have you ever had any issues with anxiety or depression?
Not that's diagnosed, but I don't know. Doesn't everybody?
Yeah.
A little bit.
Yeah, for sure.
In 2024.
How did you do in the postpartum period?
I was actually really okay. I felt really okay.
Did you have people who were checking in for you?
Yeah, I have a really good family support. And so I did quite well, I think. I was always happy. I didn't have much for any kind of postpartum depression. Maybe a little bit of baby blues, I think, but
And that's normal. Yeah. Okay.
Nothing lasting or problematic.
During your pregnancy, we like to check in with you, and we actually have some scales that we'll use, but we don't need to use a scale to hear from you that you might be feeling a little bit less like yourself during your pregnancy. So feel free to always let us know, but we will be asking you to fill out a depression scale partway through your pregnancy and in the postpartum. Was this pregnancy something that was spontaneous with you and Tom, or did you actually seek out any sort of family planning?
The good old-fashioned way.
The good old-fashioned way. And when you had your epidural, did you have any issues with the anesthesia, with that piece? Have you had any operations?
Just like my wisdom teeth.
Okay. Do you remember about how old you were when
I
that?
was about 16.
Okay. And do you recall having any issues with the anesthesia during that operation?
They put me to sleep though.
Oh, they did?
Yeah.
Okay.
And I didn't have any issues really, other than I felt kind of funny when I woke up. But yeah, they said I did really well.
Good. And have you ever had a blood transfusion?
No.
Are you open to having blood products?
If I need them, for sure.
If you need them. Do you have any drug allergies?
No.
Do you take any medications?
No medications.
Do you take anything over the counter, vitamins, pain relievers?
Yeah.
What sort of vitamins do you take?
Just vitamin D, and I think about 5,000 international units, and some fish oil, like the omegas, and that's it, and a vitamin, like a prenatal vitamin.
Prenatal vitamin? Okay. When did you start taking your prenatal vitamin?
Well, I took a multivitamin before, but then I switched to the prenatal when I found out I was pregnant.
Okay, perfect. And how many weeks were you when you found out you were pregnant?
About, pretty quick. It was about 4,
4?
like 4.5 maybe, just a couple weeks. Only a couple days after my period didn't show up.
So you've been taking your prenatal vitamin now for about 4 weeks, because you're about 8 weeks pregnant?
Yeah.
Okay. And are you tolerating that okay?
It makes me feel sick sometimes, but it's not too bad.
Not too bad? Okay. Do you take anything else over the counter, like pain relievers or things for colds or things like that?
Not when I'm pregnant.
Not when you're pregnant?
Yeah.
Okay. I wanted to ask a little bit about your exposure to some potential environmental toxins.
Okay.
So that includes things like secondhand smoke, pets.
Oh, I have a cat.
You have a cat?
But my husband told me before our first pregnancy that I shouldn't change the litter when I'm pregnant, and it sounds like he was right. So he does that.
Okay.
Yeah, and the kids help out with that too, so I don't do it. If I have to, I just, wash my hands, use gloves, and yeah, because I know that I shouldn't do that when I'm pregnant.
And your kids are sounding like they're pretty helpful?
Usually.
Are they aware that you're pregnant?
Not yet,
Not
no.
yet.
They don't know yet. But yeah, they're good.
Okay.
They're helpful.
Wonderful.
Most of the time.
And I see actually, Christine, may not have filled in what your occupation was.
Oh, I'm just a stay-at-home mom right now, or I call myself a full-time mom.
You're not just a stay-at-home mom. You are an at-home mom.
That's fair. It is a full-time job, really.
Fair enough. And then in terms of your housing situation and food situation, do you feel safe in the location that you have your family now?
I do, yeah.
So you and Tom and Sapphire and Jackson all live together. Do you feel like you have a good financial security? Are you able to afford food and the vitamins that you need for your pregnancy?
Yeah.
Okay.
I'm really fortunate that way.
And have you ever had any issues with Tom in terms of like violence or aggression towards you or the children?
No. Okay. He's very gentle.
Okay. And how long have you and Tom been married for?
We've been married since 2012, so like over 10 years now.
Okay.
12, 13 years almost. And we've been together for a few years before that, so a while.
Okay. And do you have family in Calgary?
Oh, our
great.
families both live here.
Wonderful. And friends, I'm assuming. You've been here for a while.
Yeah.
So along the lines of the toxins that I spoke about earlier in terms of secondhand smoke, do you smoke?
No.
Have you ever smoked?
No, not cigarettes.
Not cigarettes? And so what do you smoke?
I don't smoke anything now, but I did, smoke the odd joint in college.
Okay. That was quite a while ago.
Yeah. Didn't everybody do that?
Yeah, I think so. And alcohol, do you drink alcohol?
Occasionally outside of pregnancy, but not when I'm pregnant.
Not when you're pregnant. When was the last time that you would have drank alcohol?
Probably 3 months ago.
Okay. So quite a bit before you
Yeah.
were pregnant then.
We went to a wedding and had some drinks there, but I don't typically drink regularly.
Okay. All right. And do you follow any sort of special diets? Like, are you vegan or vegetarian? Are you able to eat dairy products? You're not lactose intolerant?
No.
Okay. And now with your other pregnancies, did you take prenatal classes?
I did with my first one,
Okay.
but I didn't with my second one.
Do you think you might take prenatal classes this time?
Maybe.
Yeah.
I'll have to see, you get Tom's schedule and see if we can fit something in.
Okay.
It's been a while, so maybe.
Yeah. Christine has 6 sessions that she runs 3 or 4 times a year, and you can drop into any of the ones that interest you. She usually posts on our Facebook page when they are and what the topic's going to be. And then we take turns coming to speak about the different topics, and other families come and you can meet other people who are pregnant at the same time as you. And
That'd be fun.
yeah, you're welcome to that. And I forgot to ask if you also breastfed Jackson
I did for a year.
for a year. Yeah. Do you think that you'll try breastfeeding again this time?
Oh, for sure.
Okay. How much did Jackson weigh when he was born? I forgot to ask.
That's okay. He was like 8 and change, like 3,700 grams,
Okay.
3.7 kgs.
All right. Okay. So I think at this point here, I have a good understanding of what your medical history is. It sounds a lot like you have a very, you've had normal pregnancies in the past and you are a healthy individual, which is really great. It's great to have health. I was wondering if you would be okay if I did a quick physical.
Sure.
I just wanted to do some of the components of the exam.
Okay.
One of the things that I'm going to be collecting is your weight.
Okay.
And then when I get your weight, I'm going to be calculating your body mass index. That's a pretty arbitrary number that that we use for actually some important decisions in your care, just because some of the evidence shows that people who have certain BMIs should be offered certain screenings or even certain treatments.
Okay.
So I'll be calculating that.
I just weighed myself this morning.
Oh, did you?
Does that help?
It does help.
I was 157.
Oh, great. Thank you. And do you know how tall you are?
5'5", 5'4" and 3/4", but we can round up, right?
Yeah. So that would make your BMI. I'm just going to go ahead and type that into my calculator. So your BMI is about 32.
Perfect.
And so I know just from that number and also how old you are, the kinds of screenings that we'll offer. So we can talk about that towards the end of the visit.
Okay.
And I was also wondering if you would be okay if I took your blood pressure,
Sure.
listened to your heart and lungs. And I was also wondering if you're okay if I assess your thyroid, which will involve me putting my hands on your neck.
Mm-hmm.
And then finally, I was going to do your reflexes,
Sure.
which would just involve me using this hammer to hit your knee and just eliciting a reflex that way.
Sure.
Okay, I'm just going to use this hand sanitizer. When was the last time that you've had a physical done?
I think my family doctor did it not too long ago, maybe just under a year.
Oh, okay, great. Does your family doctor do breast exams?
Yeah.
Okay, great. So at your next visit, I'm going to take a look and see when your last PAP was. I was going to ask you about that.
It was like the same time, like roughly just under a year now.
Just under a year? Okay. So at your next visit, we generally do a more thorough exam, like a breast exam.
Mm-hmm.
So you can come prepared to be able to take off your bra and to let us assess that.
Okay.
And then if you had needed a PAP, we would have done it at the same time as well.
Yeah.
So that would be the last part of your physical exam with us. So I'm going to start just by listening to your heart first.
Okay.
So I'm going to listen here and here.
Okay.
And you can just breathe normal. And then I'm going to listen here. Perfect. And then I'm going to...
Does it matter which arm?
I can use this arm. That would be okay with you.
I always have anxiety about blood pressure. I don't know
Oh,
why.
really? Well, hopefully because you've been sitting for a bit, we'll get a pretty normal reading. I see you have your feet planted on the floor.
Mm-hmm.
Your arms are resting on your thighs. And you're as calm as you can be.
Going to my happy place.
Have you had any coffee this morning?
I have.
Okay. Well,
I've
we'll
had two
see.
of them actually.
Sometimes that can impact it. So while I'm taking the blood pressure, I'm going to be quiet and then you'll be quiet too so that we
Okay.
get the most accurate reading.
Sure.
Well, I got a pressure of about 125 over 88. So you might be feeling a little anxious.
That's okay. At least it's not too bad.
Yeah. Okay, and then I'm going to go ahead and listen to your lungs.
Sure.
So I'm going to list it in 4 spots. I'm going to listen 2 spots at the top and 2 at the bottom.
Okay.
And I would put it underneath your shirt, and then I'll get you to take a deep breath in and out. And then in and out. And then I'm going to go to the base of your lungs, under your shirt, probably close to the base of where your bra would be.
Okay.
So go ahead and take a deep breath in and out. And in and out. Perfect. Okay. Next, I'm going to assess your thyroid.
Okay.
So I'm going to, if you would be okay if I sat right in front of you.
Sure.
And I'm going to put my hands on your throat. I'm just going to palpate, and then I'll get you to swallow. Excellent. Perfect. And you said you've had no issue with anything with that in
No.
your background. Okay. Great. I didn't feel like any lumps or nodules, and it felt like a regular sized thyroid. And so the next thing I would like to do is to assess your patellar reflex.
Okay.
So I'm going to just grab a higher chair for you to sit on.
Okay.
And what I want is for your legs to be dangling, or at least one leg to be dangling. And then I'm just going to hit. So we got a reflex there, which is great. And on that side. Excellent.
I was always tickled.
Perfect.
It's kind of weird that your body can do that kind of stuff without you having any control over it.
All right. So at this gestation, we actually wouldn't be anticipating that we can hear the fetal heart rate today. So we're actually not going to listen or measure. And because it is really close to the 8-week mark, I actually think your uterus would probably be just coming up over top of the fundus. I know that Christine told me she asked you to drink a ton of water and that your bladder is probably very full. So before I assess your abdomen, I'm thinking that maybe I'll send you off to do that urine just so that you don't have to. And then what I'll do is I will assess the abdomen by feeling in the 4 quadrants. So just feeling for your organs. And then I can also palpate to see if the fundus will just be over the top of your pubic symphysis at that point. Okay, so the last thing I wanted to do was just talk a little bit about some of the tests that I'd like to offer for you.
Sure.
So we do have some initial lab tests and investigations that we do. So you've already done a first trimester ultrasound. You might remember from your other pregnancies that you also had a 20-week ultrasound. That's where we look at the anatomy of the baby, the fluid, where the placenta is. And some people also like to know the sex, and we can request that in that ultrasound, depending on what your preference is.
I think we'll just wait this time. Yeah.
Fair enough. So I'll fill out that requisition. And then we also have some initial lab tests. So we generally like to do a CBC. So that's like looking at your red and white blood cells as well as your platelets. That gives us a good baseline. You have a normal history, so we don't need to add anything extra into that. We also like to pull a ferritin, which is a measurement of your iron stores. It's really common for people to have lower iron at the beginning of pregnancy just because as people who are menstruating, we typically have a lot of blood loss every month and we're a little bit under. But if you're not, that's great. But if you are, and as you get making more blood for this pregnancy, we could predict it might be going down. So we like to make sure that we address that because it's actually been associated with some outcomes that aren't favorable in pregnancy and birth. So that might be different from your previous pregnancies where low iron we sort of treated with diet and things like that. Now we generally try to supplement.
Okay.
So we can talk about that once that blood result comes back.
Sure.
We also do some tests to make sure that we can provide you adequate treatment prenatally if a condition exists. So something like HIV, rubella, syphilis, and hepatitis B. Those are all things that we can actually provide immunization for and some preventative strategies around birth. So we like to test for that. And if you're positive for any of those things, we can discuss it.
Okay.
Would you be okay if we did
Yeah, that's fine.
test?
Yeah.
The HIV test is public health reportable. So if it were to come back positive, actually they're all public health reportable. So just to make you aware that that would be a reportable condition for public health. And then we also would like to offer, because you're 8 weeks, we can actually offer you some screening for genetics for your infant. So I actually have some questions to ask around the genetic history for your baby, just potential history, just to help you make an informed decision. So I wanted to check and see if there's any chance that you and Tom might be related.
No.
I also wanted to check and see if you have a personal or family history of any of the following that I'm going to list. I'm going to especially bring it up just because you mentioned you had that French Acadian background. So one of the conditions is thalassemia.
No.
Tay-Sachs disease. Sickle cell.
No.
Cystic fibrosis.
No.
Hemophilia.
No.
Does anybody in your family history have any issues with developmental or intellectual disabilities?
No.
Any sort of neuromuscular diseases like muscular dystrophy? Fragile X syndrome? Any major birth defects in your family?
No.
Any metabolic disorders?
No.
And any other inherited chromosome disease that you can think of? Okay.
We would know about this, right? Like,
Those would be things that typically your family would share with you,
Okay.
or you would actually, in a lot of cases, outwardly be able to see. But not
Okay.
every condition is like that. Like a metabolic disorder, you might not be able to see.
Okay.
But because they are genetic in origin, typically people have been made aware that they
Right.
should share that information.
okay, yeah, no, nobody's ever said anything in either of our families.
Okay. I wanted to make sure, especially for the Tay-Sachs disease, because that is associated with the French Canadians.
Yeah, I heard that. I think the last time I was pregnant, the doctor said something like that. So.
Okay. So for yourself, we also offer genetic screening to individuals, and it is just a screen that is available. It's a blood test that's typically done before your 13 weeks and 6 days gestation. It's a blood test combined with an ultrasound,
Okay.
and it provides you a determination on whether or not your infant's at risk for Down syndrome or for spina
Okay,
bifida.
I remember that.
Yeah. So was that something that you did in your previous pregnancies?
Yeah, I did. But I think because I'm a bit older this time, we were wanting to do that one.
You were wanting to do that one.
Yeah.
You can also pay for one that is a blood test that doesn't involve an ultrasound, and it's actually a more powerful screen in the sense that it is less likely to come back with false positives
Okay.
or false negatives.
Okay.
And it's like NIPT screening or Harmony screening
Okay,
that you may have heard
one. Yeah.
That one has a 10-day turnaround, and you can do it anytime after 10 weeks. So you would be waiting another couple of weeks before you do that screening. For that screen there, it's actually covered if you get a positive screen on the one that's combined with the ultrasound.
Okay.
So some people like to do that screen first, and then if they need to, do the second screen.
Yeah.
But some people, because of their age or because of a variety of things, decide that they'd like to pay out of pocket for the
Okay.
screening.
Let me talk to Tom and see what he says, but I think we'll just do the ultrasound one.
Okay, yeah. You have some time to decide. I'll do up the requisitions, and then if you decide to, whichever one you decide to do, you can choose to take those requisitions and do them.
Okay.
And I'll be sure to write the time frames on them so that you know
Okay,
when
that's
to
good. That's hard to remember.
Yes, it is. So based on everything that I've heard from you, it sounds like you have like a low risk pregnancy. So you're definitely appropriate for midwifery care. And our level 1 hospital only does low risk deliveries. So you could deliver here if you chose to.
Okay.
And also if you chose to have a home birth, you would be a candidate for that.
Okay.
Those things we constantly assess your pregnancy, obviously, and that can change. But right now it seems like you're low risk.
Okay.
Yeah. So I think then the next time it'd be great if we could see you in about 4 weeks' time.
Okay.
And hopefully then you'll have a date for your ultrasound at 20 weeks.
Yeah.
We'll plan on doing a breast exam, but also I'd be really interested to hear some of the questions that you might have that comes up between now and then.
Okay.
But do you have any immediate questions for me right now?
I don't think so. I think we've covered everything.
It's been a lot. This is a
Yeah.
big visit. So.
It seems like every time I think of a question, you just say answer it in like the next few sentences.
Oh, wonderful. Well, if something comes up, it is helpful to write it down so you don't forget.
Okay.
Christine also has an email that you can email, and we answer those emails during clinic time. And if we need to pick up the phone, we can do that as
Okay.
well.
Okay. Awesome. Thank you. It was so nice to meet you, Joyce.
It was very nice to meet you too.